Can the appearances of Jesus be explained as hallucinations? This is arguably one of the leading naturalistic explanations for the resurrection hypothesis. Now, a lot of Christians, non-Christians, historians, apologists have weighed in on this topic. But for this video, I'm interviewing two leading medical experts. And by leading medical experts, I'm going to take some time in this interview to read their qualifications so you understand how qualified they are to speak on this. One of them in particular, Dr. Harold Koenig, has over 575 peer-reviewed scientific articles that he's written and over 55 books. So they're going to bring their medical perspective to offer an evaluation of the claim that the apostles of Jesus didn't see him alive, but instead had hallucinations. This recording is in Zoom, not how I normally record things, but I think you're really going to enjoy it and find it helpful. Can the stories of the appearances of Jesus be explained as hallucinations? There's been a lot of discussion about this, but today we have two leading medical doctors who are going to give their medical expertise addressing the question if that is a sufficient naturalistic explanation for the stories that the apostles saw Jesus. We're going to dive into some of the questions here. What is a hallucination? Are there group hallucinations? But before doing so, I'm going to take longer than I normally do on the show to explain and read some of their bios, because it's very important that you understand who these gentlemen are and the expertise that they bring to this question of hallucinations. Dr. Harold Koenig has over 575 scientific peer-reviewed academic publications, nearly 100 book chapters, and over 55 books. He has done his medical training at Stanford University, UC San Francisco, and Duke. He is on faculty at Duke University Medical Center as professor of psychiatry and associate professor of medicine. He's also an adjunct or visiting professor at medical schools in Saudi Arabia, China, and Iran. He has given testimony before the U.S. Senate and the U.S. House of Representatives concerning the effects of religious involvement on public health. Dr. Craig Fowler's distinguished academic career of service began at Duke University Medical Center. He served as the Associate Medical Director for the Free Electron Laser Laboratory. He began Duke's refractive surgery program. He then joined the University of North Carolina, where he has served 10 years full-time in the Department of Ophthalmology, where he received tenure. He recently joined Campbell University School of Osteopathic Medicine, where he serves as professor and chair of surgery, has received a number of awards for the best doctor and top ophthalmologist. Doctors, thanks so much for me to talk about this really important question today.
Thank you, Sean. It's an honor to be with you guys.
Well, let's jump right in. And I'm going to start with you, Dr. Fowler. I'm curious, what interested you in your research on questions of the intersection of theology, spirituality, and health?
Oh, that's a great question, Sean. Interestingly, as we all know, medicine hasn't always recognized the importance of faith. And it's not uncommon where people have labeled religion as a delusion, even neurosis, Freud did. Some call it regression and escape, a projection upon the world of primitive infantile states. But Americans have long recognized the healing power of faith and prayer. And it's interesting that roughly 82% or more of Americans believe in the healing power of prayer, and 64% roughly think docs should pray with those patients who request it, and 63% of patients similarly, they want their doctors to discuss matters of faith. And interestingly too, Harold, myself, and a lot of physicians, roughly 99% on surveys say that religious beliefs can actually make a positive contribution to the healing process. Yet, really, most medical studies have failed to consider that impact until recently, and experts like Harold have helped bring this to the forefront, because we can see the impact of spirituality helping in prevent the disease processes and promote the healing process, and faith has been a forgotten factor. So it's really neat that when we look at now, science is catching up, and people are figuring out that a personal relationship with God and investment in faith can help make sense out of illness. It gives hope. It changes health-related behavior, reduces the risk of disease, and many studies, and Harold can enumerate on this, shows that faith improves our immune system, enhances healing, reduces complications during major illnesses, and much more.
That's fascinating. Now, Dr. Koenig, you are one of the editors for the Handbook on Religion and Health, which is the most cited publication in its field. Would you just tell us a little bit about your role there so we understand some of the questions you're asking in terms of how science and faith intersect?
Yes, we're coming with our third edition of the Handbook of Religion and Health. That's coming out in spring. And what that does is it reviews all of the research, the latest research in the past 10 years on this connection between religion and health. And I've been doing research in this area for almost my entire career, almost 40 years. And it's been fascinating to, it's been fascinating to do the research and to be able to report the findings and to bring on colleagues from other universities. Like Harvard, Johns Hopkins, many different mainstream institutions that have also been publishing in this area and reporting similar results. So this has really been exciting to be part of, the group of researchers that are actually documenting the benefits that faith has.
Really appreciate all your work there. And I think our viewers are going to see how this translates to the question of hallucinations, because that's where there's an intersection of a faith claim and a science claim. One more question for each of you, just brutally, as medical doctors, how do you approach just questions in terms of the relationship between science and faith? Because some would say they're at odds, some would say they're asking different questions, some say there's an overlap. What's your approach as a medical doctor to examine questions of faith? Let's start with you, Dr. Fowler.
John, another great question. Historically, faith and religion is often fashioned, interestingly, the conceptual framework in which science has really flourished. And as science encounters challenging, metaphysical problems, religion can help find solutions. And similarly, science can help distinguish or establish the role that religious faith can play in health and well-being of both individuals and society. So faith, religion, and science, from my standpoint, should not be regarded as mutually exclusive, but rather as complementary. And just to highlight this point, consider what the Bible has said about preventing disease. It's really amazing. Back in the Old Testament Leviticus, it says, you shall not eat any fat from an ox, a sheep, or a goat. And if you think about this, fatty, cholesterol-rich plaques from such meats, they form in the arteries, block openings, it leads to arteriosclerosis and heart attacks. There's a proverb, it says, don't join those who drink too much wine or gorge themselves on meat. And if you think about, Americans, if we want to maintain optimal weights and avoid obesity, we could actually decrease coronary artery disease by 25%, and strokes as well would drop maybe even 30%. And one of the things that I think is so fascinating, we don't look at it as a science textbook, but think about this. In Deuteronomy, it says, and I'll try to quote this, designate a place outside the camp where you can go to relieve yourself, and as part of your equipment, have something to dig with. And when you've relieved yourself, dig a hole covered up with excrement. But, that sounds like, common sense now. But if you think about this, if we had simply followed that biblical edict that was written 3,500 years ago, before the theory of infectious disease spread was ever understood, we could have prevented devastations of typhoid, cholera, dysentery, and other epidemics. And one other thing, just to highlight this, there's a proverb that says, anxiety in the heart of a man weighs it down, but a good word makes it glad. Think about this. And Harold's the expert on this, but there was a study of open heart surgery patients that found, get this, 75% of depressed patients died, but only 15% of all other patients died. And there was a long-term study, similarly, of over 2,000 men that demonstrated that those rated at the outset of the study as psychologically depressed showed a cancer death rate that was twice that of the rest of the group. Isn't that fascinating?
That is really interesting. So you see a positive contributory role, so to speak, between faith and science. How about you, Dr. Koenig?
Well, I totally agree with Craig that faith and science are really complementary. All of truth is God's truth. And science is a method of determining truth, and faith is a method of determining truth, and they ought to be quite complementary. And I think they are. I really think they are. In fact, the whole notion of science is based on a predictable universe, a universe that you can predict ahead of time what might happen. And that's exactly what science does. It is designed to help to predict in the natural world, assuming that everything is organized in a certain way. That was not true for other cultures, other than within the Christian culture. So science and medicine and faith are all very complementary. And in fact, when one is used without the other, I think we're losing something.
This is super helpful to give myself and our viewers a sense of how the two of you approach questions of science and faith. Let's narrow down, so to speak, to the question of hallucination, a scientific claim that explains the appearances of Jesus to the apostles. Dr. Fowler, maybe it'd be helpful if we just start with the definition. So what is a hallucination?
Well, simply speaking, and that's a great question because you want to clarify things at the start. But simply speaking, just trying to distill it down in simplest terms, they're visual experiences of things that are not there. A little more technically, we can call them perceptions that occur in the absence of what we would say is a corresponding external sensory stimulus. Now, experientially, they're often vivid and clear, and there's this full force and impact of normal perceptions, but they're not under voluntary control. And they can occur in any sensory modality. What I mean by that, whether it can be visual, hearing, touch, taste, or smell. Now, as an example, auditory hallucinations, they're very characteristic in schizophrenia, and Harold can comment on that. And they're used to experience as voices, whether familiar or unfamiliar, and they're perceived as distinct from the individual's own thoughts. And true hallucinations, technically speaking, they've got to occur in the context of a clear sensorium, whereas if you had someone falling asleep, there's hallucinations that are actually called hypnagogic, or if they're waking up, they're called hypnopompic. Those are considered to be within the range of normal experience. And similarly, hallucinations often occur with the use of drugs, withdrawal from alcohol and alcoholics. And if people in certain cultural contexts, they can be part of a normal religious experience. And we can elaborate a little bit further as you need.
Dr. Koenig, that is super helpful. Just for clarification, sometimes I've heard people compare someone who had a hallucination with somebody who said they saw Bigfoot. Why are those very distinct phenomena?
I think they are very distinct because when somebody says they've seen Bigfoot or a flying saucer, those are more what we would call illusions. Those are misperceptions or misinterpretations of perceptions. So they're not a hallucination. They're a lack of the ability to interpret correctly what they've seen. So that is more of an illusion rather than a hallucination. A hallucination, as Craig said, is seeing things that aren't there. Whereas an illusion, it's there, but you're just misinterpreting what it is.
Now that's really helpful. So hallucinations are entirely internal, and a vision, Bigfoot, UFO, there's something external, but you misperceive what it is.
Exactly.
Okay. Now, when I study hallucinations, it's really textbook for me, but the two of you have dealt with patients over the years that have had hallucinations. So maybe Dr. Fowler, we'll start with you. How often do you interact with patients, and what are some of those experiences like when somebody's actually had a hallucinatory experience?
Great question. And so first, let me preface it by just saying that, many people keep quiet about these phantom images for fear they're going to be labeled with dementia or having a psychiatric problem. And so their hesitancy to speak up really can explain why hallucinations were thought for a long time to be relatively uncommon until more recently. So in that backdrop, particularly in ophthalmology, where we have people with low vision problems, it's not uncommon. Consider this: 12% of people with age-related macular degeneration experience visual hallucinations, and what they're called are Charles Bonnet syndromes, or we call it CBS for short. But it's a condition that some people get when they lose some or almost all of their vision, and it causes them to have these visual hallucinations where they're seeing things that aren't really there. And what happens, just to help the audience understand, in normal vision, in healthy patients, light is entering the eye much like a camera. And this light goes to the back of the eye, to the camera film part, which is really the retina. It's the light sensitive tissue in the back of the eye. That retina then converts those light rays into what we call visual message signals. It's not actual vision, but signals, which are sent to the brain. And then that's where vision happens. Vision happens in the brain. It's not in the eye. Okay. And when people lose vision from diseases like age-related macular degeneration, glaucoma, diabetes, it's called diabetic retinopathy, their visual system doesn't process new images. So without this visual data coming in through the eyes, the brain amazingly fills this void, and it actually makes up images and recalls stored images, what they may have seen in the past, for them to see. And that's what causes these visual hallucinations of CBS. And it's similar to how people have kind of, when they've lost a limb, they may feel this phantom pain, and it's not a signal of mental health problems. And these hallucinations are in people, with significant vision loss, and they're not stemming from neurological problems. But there's other ones, visually we can talk about. But what's happening is their brain is craving these images to process, and somehow, since they can't find anything, the brain resorts to kind of making up these images, and we're recalling images from memory. And what happens is, characteristically, these phantom images, they may be simple lines, shapes, flashes of light, or more complex images of faces, even people or animals, and they can occur at any time. They can last for seconds, minutes, and reportedly even hours. Now, I've never seen with hours, but I've seen them for the seconds and minutes. And sometimes the images will remain still. Other times they'll move around. And those people with significant vision loss, especially if it's of the central vision, are the ones most commonly affected in my type of practice.
That is really helpful and insightful that you've seen and diagnosed and worked with people more common than we would think who've had hallucinations. Dr. Koenig, your experience.
Really, what Craig is saying is making a lot of sense, because people who suffer, or people who are put into environments where they are sensory deprived, the brain will actually produce these images as well. So it's this sensory deprivation that causes the brain to produce this. It's the same thing with hearing. People who are losing their hearing start to have ringing in their ears. And what that is it's the result of low hearing, that the brain creates this sound in response. So this is really what's going on with many hallucinations. Now, the kinds of patients I see mainly older adults, and in older adults, they may have dementia, they may have delirium, which is a physiological alteration, and then hallucinations will occur in that setting. But typically, those hallucinations are not real together. They're fragmented. They don't carry on interactions over time, with other. They don't. It's more, they might see something, and they may see it periodically, and then they may develop a delusion about it, and that way. But it's not fully formed like our interaction here together. It just doesn't occur that way. So that's been my experience.
So this brings me to the next question, which is, do hallucinations lead to a change in belief, or do they just project something that's already present? Maybe you could weigh in on this one, Dr. Koenig.
Well, hallucinations don't usually change belief. And they certainly don't cause a person to then die for that belief. You know,
Hmm.
It's typically something that is manifested from the person's past that comes up in the hallucination. So it's something they've experienced or something internal that's already present. So it's not usually so convincing that they're willing to die for it.
Okay, so that's fair. So there maybe are some examples of changed belief, but they're far more common projections of something already in the mind, maybe more like a dream, so to speak. Is that fair? It's just kind of expression of thoughts and stresses that you've had. Okay, that's awesome. Dr. Fowler, let me come to you. Maybe give a sense of who is most likely to hallucinate. And by that, I mean, are there differences between men and women? Are there certain emotional states? And does this match up with the accounts that we see in the Gospels of the hallucination accounts?
That's a really great question. And without getting too technical and try to review literature, I'd like to kind of back off a little bit and just give some general things and overview and some perspectives on this controversial issue. So just to review again, hypnagogic hallucinations, like when someone's going to sleep, are really pretty darn common in the general population, 37%. Hypnopompic hallucinations, that's when you're waking up, right? They're relatively common, 12.5% in the general population. And technically speaking, just to kind of get this out of the way, hallucinations are not a specific diagnostic entity. Medically, they're better classified as a symptom. So when we talk about this, we should say hallucinatory symptoms are commonly recognized, and they arise from oftentimes some underlying causal factor. Now, what are the most common ones, like what you asked? Well, for many medical reasons, and there's a whole host of them, but I'll list some of the common ones: delirium, migraine. There's a thing called visual release phenomenon. It's typically manifesting in this impaired vision, like we just talked about. But alcohol and drug-related conditions, seizures, dementia, any of these there's a number of central nervous system diseases that can do it. And particularly if they affect the visual cortex regions of visual pathways, especially in stroke. Stroke's really an issue. And then, of course, the psychiatric conditions that Harold will talk about: psychosis, schizophrenia, narcolepsy. And basically, clinically, they're manifest as individual, uniquely subjective visual experiences. And they're particular to the individual, much like a dream, like you mentioned. Now, in ophthalmology, individuals who commonly experience what we call acephalgic or their migraine-associated visual phenomena, they get these zigzagging lines or starbursts, and they float across their visual fields. And they're described as technically fortification spectra. But they don't experience the same visual phenomenon. They're individually distinct, much like a fingerprint would be. They're common, but they're not the same. They're unique amongst these individuals. And so if you keep that in backdrop, that's really helpful. So those are pretty common. What's not common at all are what's called multimodal hallucinations. That's a fancy term by saying, look, hallucinations can occur in different sensory modalities, where vision, hearing, taste, touch, and so forth. But if we look at the prevailing literatures, excellent studies done by Leroy, just to look at, and he looked at young, middle age, and old age. And I'm just going to, highlight auditory and visual. They're combined together in middle-aged folks, like the apostles, 0.8%. If it's auditory and olfactory in middle age, it might be 0.8%. But if you looked at auditory, visual, olfactory in old folks, 0%. Tactile and visual in the middle-aged folks, 0%. And interestingly, just for a frame of reference to get our head around this, because you hear a lot of talk about this, but the most common one really with a unimodal experience of what we call a sensed presence. And that's the most common. And in middle age, it's 20%. In the older age, it's almost 30%. And what's really common that you hear about are these adults that are in the midst of grieving. And they get these grief hallucinations, and it's roughly 30 to 60%, depending on what studies you look at. And it usually occurs, among those who've been married for quite a long time. So that it's kind of helpful. Now, with regarding, does this match up with what we know about the apostles? Well, just briefly, we can get into this more, but when the disciples, they encountered Christ, shortly after finding the tomb, they experienced his bodily presence, not as a mirage, not as an apparition, not as a phantom-like image, consistent with visual hallucinations as we know them medically speaking, but truly as kind of a living, physical, fully embodied form with whom they interact. And just keep in mind, hallucinating individuals, they don't report accompanying interactive group conversations, nor do they report that their apparitions physically consume food items, even if the responders may have offered some. These kind of details and interactions are way too specific, too detailed, and too interactive to involve group hallucinations and normal individuals. And more importantly, as Harold will attest, the apostles, as his ways report, they didn't have mental disorders or delusions.
That's really helpful. So if we just go statistically, what we know about the group of people who experience hallucinations, and then we look at what the Gospels report, it seems like, probabilistically speaking, we wouldn't say it's impossible, but it's so far remote, it just doesn't match up with the kind of experiences that people have. Is that fair to sum up the key points you were saying?
I'm so loving that you asked that. So let me comment on that for a second. Not to steal your thunder, but that you raised the key point in my mind. While multimodal hallucinations can occur, and we know they're rare, especially in 3 or more modes, like auditory, vision, taste, smell, tactile, touch, right? They were reported to occur commonly together in the disciples' accounts. And, when you have all 5 senses involved, this is incredibly rare, right? So to occur across multiple groups and multiple days, as well as at least one account involving 500 individuals simultaneously, is really uncommon. Let me give you just a way to dramatize this, to give you a mental picture. If we were to arithmetically use the multimodal prevalence rates for just the auditory visual, just those two, and we use it at 0.8% in middle-aged persons that were the same age of the disciples, 7 disciples in John 21, all right? So just take that one case in John 21, where you had 7 of them. You basically would have a prevalence of 0.8% in each individual, right? Each individual disciple multiplied 7 times. That means 0.8 times 0.8, 0.8 times 0.8 times 0.8 times 0.8 times 0.8, 7 times. The computer result of this, and get this, all right? I gotta look at my little note here. My note, it's 0.00000000002%. That's basically impossible, right? I mean, wow. It's not totally impossible, but think about it, that's 14 zeros before the 2%. Prevalence is always reported in percentages. So, is it unlikely? You bet. That was a great question.
That's a great way to sum it up. That's super helpful. No, that was complete, and you gave us the numbers. But before we move on, I want to see if Dr. Koenig, if there was anything you wanted to highlight or just add to help us understand the nature of the question.
No, I think Craig has got it right on. And I think what he's done, he's calculated, this based upon the existing literature of epidemiologists who have determined that, the prevalence of both auditory and visual hallucinations together is 0.8%. So 0.8% of people will have both auditory and visual hallucinations together. And if you have 7 people, then all seeing and hearing the same thing, plus eating together, and eating food, I mean, that just is astronomically unlikely that would occur. So I think that those figures really say pretty much everything in terms of the likelihood that the disciples were all hallucinating together in multiple modalities. Extremely unlikely.
The idea of multiple modalities is so helpful to me, because as a non-medic, when I would study this, I just assumed that all the modalities were present, but it never crossed my mind that the different modalities all together are even less likely to occur. And then you add the number of individuals having these individual experiences, mathematically, it just gets more and more remote.
Exactly.
Now, I want to throw a curveball at you, Dr. Fowler. I guess I'm trying to think of the skeptical. I might say, look, these are stats from today. This was 2,000 years ago. how can we assume that the prevalence of hallucinations today and this data would be relevant 2,000 years ago in a different place in a different time?
Well, that's a great question, but let me build on that for a second, because, we picked the best case scenario of auditory and visual of 0.8. If you will think back for a second, if you just added, instead of just auditory and visual, you added smell, the incidence in older folks is 0%. If you, instead of eliminate the olfactory, auditory part, and you add touch, vision and touch, where they touched Christ, middle age is 0%, and older age is 0%. It's only the young, it's 1.5%. So to do it across all five, we know it's basically zero. It's not, we don't have any record of, across all five, and I mean, it now becomes not just astronomically impossible, incredibly unlikely. And so we have no documentation that would ever support that idea that it was any different in the past. Right. And so, Harold, you should weigh in on that too. So what do you think?
Yeah, I think that we're dealing with human beings here. Okay. And human beings are not that different than now than they were 2,000 years ago. I mean, their physiology is basically the same. When you talk about evolution, if you're talking about evolution, you're talking about like millions of years, not 2,000 years. So we are basically the same human beings as we were 2,000 years ago, physiologically and largely psychologically as well.
That really helps. Let me come back to you here again, Dr. Koenig, more about the nature of hallucinations. Are hallucinations one-time events that people have, or do they continue? Like people have them once every week for a while? Like how long do hallucinations often last?
Well, it certainly depends on whether a person has a psychiatric illness. If they have a psychotic disorder, then you can have hallucinations over time, and it can last for months, years, decades, if they're not treated. So that's possible but for the general population of just normal people, and there is really no indication that the disciples had a psychotic disorder. There's no indication whether that they had schizophrenia, that they had bipolar disorder, that they had dementia. There's no indication, because these disciples were leaders of the church. They had many people who followed, and they organized and directed. Somebody with mental illness just can't do that. So if you talk about just a normal person in the general population, those are typically not going to last that long. They're not going to last for 40 days. I would expect, not in multiple situations and different time points and different in characteristics. So the long-term nature for normal people is just they just don't see these hallucinations every day consistently, and so it just doesn't happen.
In some ways you've answered this question, but I want to have Dr. Fowler weigh in if that's your experience as well with hallucinations, and how you see that matching up with the appearances of Jesus over time, at least for 40 days in the Gospels and of course in Acts.
Oh, Harold articulated that beautifully, but just to elaborate, in Luke chapter 24, Jesus appears to 10 disciples. Thomas was the one absent, as you recall. And he states, look at my hands, look at my feet, touch me, make sure that I'm not a ghost, because ghosts don't have bodies that you see that I do. He also asked them, do you have anything to eat? And they gave him a piece of broiled fish, and he ate it as they watched. And if you think about in John 21, the account relates, extended group interactions and conversational dialogue between Jesus and the disciples, while they were fishing at the Sea of Galilee, as you call. And that included multiple appropriate question and answer response dynamics, including Jesus breaking bread, consuming a physical meal together. And, that doesn't even talk about the one in 1 Corinthians 15, where he was seen by more than 500 of his followers at one time. So, it's really yeah, it just doesn't match up with hallucinations from a medical perspective.
That's great. Very, very helpful again. Uh, Dr. Koenig, let me come back to you with another question. I've heard some critics say that certain apostles may have been primed for a hallucinatory experience. And I've seen references to Peter, for example, who experienced deep grief and was already prone to visions. We see this in Acts chapter 10. Or maybe Paul, obviously not one of the disciples, but became an apostle. He was hostile towards Christians, very angry, and seemed to be prone to visions, as we see later in some of his writings as well. So is it possible that at least some of the apostles, including Paul, were primed for this? So maybe the likelihood that they had it would be higher than the general population.
It's possible. It's possible that they had some predisposition towards hallucinations, but what about the other 11 apostles? You don't hear that they had these experiences. So perhaps, but again, it's a long shot. And again, we just don't have any corroborating information from history that that they had those experiences. We're dealing a lot with what we have in the scriptures. And so if we are assuming that the scriptures are 100% true, then it's just unlikely that those predisposing experiences that we think were hallucinations or critics say were hallucinations were then the cause then of all of the other experiences that not only they had, but the other people had as well. So again, it's possible, but it's just not enough to explain all of these different appearances in multiple modalities. Just not enough.
I appreciate that you say it's possible. A good friend of mine, co-author J. Warner Wallace, Cold Case Detective, he says, in a court of law, anything is possible. What I need to know is what is reasonable and most probable. So sure, it's possible with Peter and Paul. Where's the evidence? And how would that account for the rest of the apostles? That's where you say this just seems extremely unlikely.
Exactly.
Dr. Fowler, one of the big questions that comes up a lot is the group hallucinations that we see, whether it's the 7, whether it's the 11 or the 10 without Thomas, then with Thomas, the 500. What's your assessment of shared hallucinations? Are they possible? Do we see this showing up in the literature?
I'm so glad you're asking that. And Sean, this is one of the reasons you're such a great apologist, because you research things so incredibly well. And this is largely ignored by, unfortunately, in the theologian community. Again, we're not sharing the coffee pot with the theologians and medical community, but basically shared hallucinations are possible. And while they're uncommon, things like mass hallucination, or at least what we call the same hallucination by 2 persons, is called a shared psychotic disorder, or it's also known as folie à deux, and it has a bunch of other names. They've called it communicated insanity, contagious insanity, a whole host of other names, which I won't repeat here. But basically, it's a rare delusional disorder shared by 2 or more people with close emotional ties, delusional disorder. And to help differentiate it, the diagnostic criteria indicate that this disturbance is what we would say, quote, not better accounted for by another psychotic disorder, something like schizophrenia or mood disorder, or something due to a substance or something, medical. So the hallmark of these disorders is that the patient doesn't even believe that he or she is deluded or in need of psychiatric assistance. That's clearly not considered with the apostles. And when we think about these historical accounts of the disciples, they didn't manifest any other psychiatric aspects that are required for a mental disorder or other psychiatric related pathological condition for that matter.
Okay, so I want to make sure I'm tracking with this one. How is it that people have a shared hallucinatory experience if by definition a hallucination is an individual experience like a dream?
Well, again, it's a delusional disorder. So it's not a
Okay.
hallucination. It's a delusion. It's a
Okay.
delusion that they're sharing. And it's usually shared by two people with close emotional ties. And that's a really significant characteristic of that. So could you say you have close emotional ties amongst the disciples? Well, yes, but they were not delusional. And that's quite a different thing. And, time permitting, we can talk about the definition of delusion, but these were not hallucinations that we're talking about. And so hopefully the terminology isn't too confusing, but that's why these other terms, where we call it contagious insanity, right? Infectious insanity. They also call it psychosis of association, which I think is a good term. Sometimes they call it double insanity, if that helps you think about it. Those are good terms that give you some idea that there are two people that are delusional. So you have multiple delusional people. We just happen to call it shared psychotic disorder. So it may be bad nomenclature, but that's what's happening.
Okay, so just to make sure our viewers and myself understand, you're not using these terms like delusional and psychotic as a way of dismissing this for apologetic purposes. You're appealing to what the literature and the medical community understands about this, and then you're comparing it to the apostles and saying there's no reason to think that they're in this delusional state as an explanation for the appearance claims. Did I get that correct?
You got it correct. Harold, do you want to
Okay.
comment on delusion so everybody understands why we're using that terminology?
Well, a delusion is a fixed false belief. So it's fixed, person cannot be dissuaded from it, but it's a false belief. Now, in terms of the group hallucinations, usually those group hallucinations are fairly simple. If somebody, a group, for example, may claim that they see, Mary, for example, they're in the middle in Europe. I'm not sure if it's Paris or some other place, not Paris, but France, or Italy, where they claimed, groups of people have claimed to see the Virgin Mary. Again, these are fairly simple visions that the group is having. They're not complex interactions like we're talking about what the disciples of Jesus went through over 40 days in terms of eating together and doing stuff together. That is just unprecedented. So
Okay, that's a really helpful distinction. I appreciate you weighing on that. Let me stay here with you, Dr. Koenig, and ask you this. One response that I've heard at times, the hallucination hypothesis, is that hallucinations often occur in certain kinds of environments. The appearances of Jesus are inside, outside, different emotional states, individuals to groups, and this seems to weaken the overall hallucination hypothesis. Is there validity to this criticism, or would you push back on that?
yeah, I'm not sure that there is any data to support this idea that the location of the hallucination, whether inside or outside. I'm not aware of any research that people have done that has looked at this. So I'm thinking maybe that argument doesn't have much scientific evidence to back it up. I think that I think those are claims, but I don't know. I think hallucinations can involve among older adults that I take care of. If anything, they may see something outside. I mean, they're inside typically, and they might see something outside going on, but they're usually inside.
So I just want to also just add to that to realize that, most accidents occur within 25 miles of home because that's what you're driving most commonly. Well, when we think about like the migraine related phenomenon that we have visually, they can have these what we call starbursts and blurring out of the vision or other kind of visual phenomena. They can occur when you're driving outside any term. It's not location specific. Stress, of course, may aggravate it, but these spasms can occur independent anywhere, anytime. And we don't have good data to really differentiate this inside out matter, as Harold's saying. But I can tell you, location is not specific. and a lot of the visual phenomena we have. Our age-related macular degeneration folks that have those visual disorders that we're talking about, the 12%, it's inside, outside as well. So no difference that we're aware of.
That's really helpful. Very, very helpful to look at the data. I want our viewers to see. I'm going to come back in a minute and ask each of you to just give your medical assessment, kind of in sum, whether or not hallucinations are the best explanation for the appearance claims of Jesus. But I want to make sure our viewers understand. Some of you might be thinking, well, wait a minute. We don't think the Bible is 100% accurate and reliable, as Dr. Koenig said. Maybe it's legend. And I would say, okay, that's a different claim that we would then have to assess by different criteria. All we're looking at today is one naturalistic hypothesis that says the apostles did not really see the risen Jesus. They had hallucinations. And since a hallucination is a medical diagnosis, so to speak, really a symptom to be more accurate, I'm learning and listening today. Thank you, Dr. Fowler. This is a medical question. Our two guests today are weighing in and saying, okay, let's look at this and see if it's the best explanation for these claims. So maybe we'll just have you each kind of weigh in and give your assessment, medically speaking, about the hallucination hypothesis. Let's start with you, Dr. Koenig, please.
Okay, Sean, so based on the information that is contained in the Bible, and the Bible is actually a very good, I think, a very good record of history at that time, because we don't have that many records of what's happening at that time, even historical records. We're talking about 2,000 years ago. But assuming that what the Gospels are reporting is true, and again, we have 4 accounts of 4 different individuals also on that, just medically, psychiatrically, the hallucination hypothesis just doesn't make sense. Just doesn't make sense when you consider that if, in fact, Jesus appeared to multiple individuals, interacted with them in multiple different ways through different sensory modalities across time, and these individuals were not mentally ill, there's no indication that they had a mental illness, then the hallucination hypothesis just doesn't hold water based on medical or psychiatric logic.
That's a great summary. Dr. Fowler, your assessment of the hallucination hypothesis.
Building on what Harold said, I couldn't agree more. And there's some other twists to this too. And just to rehash, just if we looked at the auditory visual, the computed result just on that one component was 2%. If you extract it to the touch and the taste, we know it's virtually impossible medically. It just can't, it's not likely. I did want to interject some other comments though, because people will argue about, well, what about apparitions? And I would just like to interject because there's a lot of parapsychology literature out there and so forth. I won't get into a lot of detail, but I want to comment and say that experientially, the apparition is often, misunderstood for a living person by those that are having this, and they may be 3-dimensional, and they often show awareness of the living person in their presence. And occasionally, the apparition is capable of uttering a few words, even, and may even be reflected in mirrors, so-called, in the literature that we can see. And sometimes not even peer-reviewed at all. But this apparitional experience that they can report may last for a few minutes, and if cornered, it will disappear or pass through a wall or door, so forth. But importantly, those apparitional figures, they can appear opaque as if solid, but they are not able to grasp this. They can't touch them. They can't grasp them physically with it. There's a whole lot of data we could comment on. Secondly, if you think about the big context of this, if you think about the disciples' appropriate non-delusional cognitive functional state, in the ancient world of that time, historically, since we were backtracking, someone in the ancient world, if they had visions of the deceased, they were not taking us that they were alive, but that rather that they were dead. So, non-psychotic, normal cognitive functioning individuals relatedly, as you well know, you've done such great research on the, martyrdom of the apostles. They might die for something what they believe is true, but no one really dies for something they know is false. So, if the purported hallucinations were actual subjective visual experiences, including like auditory or taste, touch, combinations, other variants, then you also have to ask the question, because we think that's impossible medically, then Jesus' actual body should have been arranged in the burial tomb, but it wasn't. They couldn't produce it. So that combination of all the evidence just really makes this, beyond unlikely. So when you think about it in the context.
That's really helpful. That's a piece of this we haven't added today, because obviously it goes outside the medical data. But if they had hallucinations, the body should have been in the tomb. There's also evidence for the empty tomb. So that's really, really helpful. Thanks both for summing up. A final question for each of you. Dr. Koenig, if there's people watching this saying, you know what, I want to follow conversations that are taking place on the intersection of kind of science and theology and faith, what could people watching this do just to kind of stay abreast of the conversations and the research? What would be the best place for them to go to, maybe?
I would encourage people to go to our website, the Duke University Center for Spirituality, Theology, and Health. It's got a lot of information there. Most of it's for free. And I would encourage you to go there to sign up for our e-newsletter. I spend a couple of days every month reviewing all of the research in the field, and I summarize it and comment on it. And it's for free. All you have to do is go to our website and sign up for it. And we've got videos of different speakers, different researchers on all sorts of topics. That we have a monthly seminar that that we have different speakers come in, and it's by Zoom. So all of those are recorded. All of the PowerPoint slides or PDFs of those slides are there on our website. So just go to our Duke website. It's got a ton of information that can help you learn more about faith and health, and also continue to follow the new studies that are coming out all the time showing these connections.
Please tell us the title just one last time, specifically where we would find that on the Duke website.
Well, Duke University Center for Spirituality, Theology, and Health. All you have to do is put that in your Google search engine. It will be the first thing that comes up. Duke University Center for Spirituality, Theology, and Health.
I'm so glad I asked that question. I'm going to sign up for that newsletter because I want to be abreast of what's taking place in the research. Super, super helpful. Dr. Fowler, I actually have two questions for you. One, I'm just curious. I want to hear your journey to faith as a medical doctor. And obviously, we could probably do an entire show unpacking that sometime. But as a medical doctor, and you've made a huge impact in your field, why do you believe in God? Some people would say that's unscientific.
Well, as you know, everybody's individual experience is different. But first, and Sean, you're clearly one of the leading experts on the evidence behind Christianity. I mean, we know Christ died, and we know he raised from the dead, and there's a ton of evidence to prove that. How do they argue that away? So it's an intelligent faith. And in terms of my own journey, I was blessed to be raised in a Christian home, but I really didn't come to what I would say is a saving faith, committing myself as a Christian until age 16. A gentleman in my church, a big fan of wrestling, and that's what sports I did. My summer coach was a videotape for the Olympic team, and I came to faith through a Fellowship of Christian Athletes Conference, and was life-changing ever since. Not that I haven't made tons and tons of mistakes, but it's really grounded me. And truth is truth. And that's the beautiful thing about when we look at these aspects of Scripture. It gives us a true roadmap for how we need to live our lives. And it doesn't necessarily mean it's going to be easy, but we know the ultimate destination, which gives us a lot of hope. Did that answer your question?
Yeah, absolutely. A final question, which is somewhat of a shameless plug, but you've been in two of my classes. and just absolutely thrilled and honored to have you in class. Your posts are amazing. The insights you bring, I learn as much, if not probably a lot more from you than I feel like you do for me. But with that said, I'm really curious why you chose to do this program. You've thought about this and what you're, obviously you've thought about these issues, incredibly educated on science and theological kinds of issues. So why do this program, and what's your experience been so far?
Oh, thank you for asking. And first, I'd like to say I've really had the pleasure. We have a Triangle Christian Medical Dental Association's chapter here of Duke, UNC, Campbell University Medical School. And we'll invite area healthcare trainees in all the disciplines. And we've hosted weekend retreats. We have a lake property, and we've been blessed to have some of the really great apologists, the late Norm Geisler, Frank Turek, Hugh Ross with Reasons to Believe. And it's amazing as we have these people come in, they really challenge you to understand why it is that you believe what you believe. It's not a blind faith. It needs to be intelligent faith. And they so challenged me to say, look, you really got to understand this. And we've had great connections with Southern Evangelical Seminary in Charlotte, which is wonderful. But, arguably Biola is the best apologetics training program in the world. And Sean, you're certainly one of the best teachers, and you're very humble and so gracious. Your students all love and admire you. And I think learning from you is like trying to take a drink out of a fire hydrant. I can do shameless, and you're so modest. And if this goes out to anybody, I'm going to say, if you want to take an apologetics program, it doesn't get better than the Biola program. And those professors are so gracious, so humble, and you guys are just awesome. And I'm so privileged and honored to learn from you, an amazing teacher and such a humble apologist. You're terrific, and all the teachers down the line are just really spectacular.
Well, you're too kind to say that, and I want to personally thank both of you so much for just the work that you do helping people who experience things like hallucinations, and as painful as that can be, but also weighing in on, as you described, the unlikelihood that the appearances of Jesus could be explained away as hallucinations. Those of you watching, again, make sure you go check out the Duke Center for Spirituality, Theology, and Health. Sign up for their newsletter. Dr. Harold Koenig sends out some of the latest research and data monthly. I'm going to sign up for that. And think about joining us at Biola in the Apologetics program. You can have class with me and Dr. Fowler. Information is below. And make sure you hit subscribe, because we've got some other interviews coming up, including one with an atheist talking about, does our storytelling nature have an evolutionary explanation, or does it point to the fact that we're part of a larger grand story and God has imprinted that on us? I get to have a conversation with an atheist about this, so make sure you hit subscribe. God bless and have a wonderful day. Thanks for watching.